Welcome to today's podcast. Today we're talking about one question specifically. Is healthcare right for you? I'm Regenia Stull, and I have the pleasure of talking about my journey through healthcare, as well as introduce you to some people who know so much about how to get into healthcare and how to be successful once you've entered into the field. Now, this is something that I did not struggle with as a teenager. I knew early on that I wanted to go into healthcare, specifically nursing. And when I was in high school, I went to a CNA program. And the very first thing that we were able to do once we started that program was to become a volunteer or a candy striper in the local hospital. And we were able to wear the little pink and white striped bib overall dress outfit. And we loved that so much. We felt like we had arrived. Today, I want to talk about what it really means to arrive in healthcare. So today, I want to talk with a few people that can help you learn how to get into healthcare and how to make the most of it once you're there. So to begin with, I'd like to welcome my guests today. We have Jamie and we have Jacklyn with us today. So I will stop talking, which is rare, I know, and allow you to introduce yourself. Let's start with you, Jamie.
Yeah, my name is Jamie Young, and I am the talent sourcing strategist at Liberty Hospital. So, in my role, I get to do a little bit of everything. Really at the heart of that is, I'm a recruiter, but I get to really strategize and partner with a lot of subject matter experts at the hospital. I get to work with just a variety of different people. I recruit for our graduate nurse program. I partner with our HR business partners on hard to fill roles. And I work really closely with Jacklyn on, talent pipelining and education strategies.
Okay, well, welcome. Welcome. Jacklyn.
Hi there. I'm Jacklyn Gentry. I'm the Senior Director for Professional Practice at Liberty Hospital. And in my role, I get to do a lot of work with the community, from high schools through colleges, universities, increasing access to healthcare education, how to get people interested in healthcare, hopefully bring them into the hospital setting with us. And then I also focus a lot on just recruitment, retention initiatives in general, and working with our leaders.
That was a lot.
Yeah.
From both of you. That was a lot. Jamie, I want to start with asking you a few follow-up questions. Now, you said that your job is as a talent sourcing strategist at Liberty Hospital. Could you tell all of us what those words put together actually mean?
Well, I just get to partner with a lot of different folks to help bring in talent and to drive application flow across the hospital. So a lot of brand awareness, a lot of, people will, I'm on our website and they get to send me their resumes and say, hey, I'm really interested in healthcare. Is there a place for me? And so I get to have a lot of those really general conversations with folks. It's just really exciting. And, I love, workforce development, pipeline development. I get to do a lot of that promoting of, the student programs that we have initiated in the last 2 years. And
yeah, there's a lot of those.
There's a lot of those. We have a lot of students in our building, and that's really exciting.
It's so exciting. I grew up in a church setting, and my dad would always say, if you don't have young people and just young people, babies, young families in the church, then the church will not survive, right? That can be equated to every business and every profession out there. If we don't have new people to healthcare, looking at healthcare and saying, I think I might want to do that, then healthcare will not survive. And that's really one of the primary things that you have the opportunity to do. Somebody could call and say, hey, I think I want healthcare. These are the things that I like. What do you think?
Where do I start? A lot of people, we host and do things in recruitment like, walk-in Wednesdays. And we, get to sit down and have a conversation with folks and say, hey, I want to be here. I want to be here. I want to be in healthcare, but I just don't quite know where I fit. And, my philosophy in healthcare, I've been in healthcare a really long time. I started off as well as, a CNA my senior year of high school. And I was able to go to the local tech school and have this great opportunity. And, got my CNA, went through medical terminology, was a 1-year long program.
It's a different language,
It's
isn't
a
it?
completely different language. And that was probably 20 years ago. But, it was really exciting because, I got to do clinicals at, in long-term care facilities with a geriatric population.
Nice.
And then I was able to go on and back then it was kind of difficult for CNAs to kind of get into the acute care setting. And I, was able to, get on as a CNA, and I, 18, 19 years old, and I'm walking into a room.
Yeah.
It was cardiovascular thoracic unit, and learning to take care of patients that literally have, a tube coming out of every orifice of their body. So, but, I worked the floor as a tech. And I remember my very first day in that role. I had a fantastic preceptor. She said, "You can't quit and you can't cry."
Oh,
and I was like, okay, I got this, and I saddled
great
up.
Advice.
Yeah, saddled up. It was 12-hour shift. I worked the day shift, tied my tennis shoes tight and carried a pager. And
you were there.
I was there. Yes,
You had a pager.
I had a pager. I know, answering call lights and going about. I mean, it was a big unit. It was like a brand new 48-bed unit. So, yeah, we worked with fresh open hearts and lung patients, and so. You both know, being nurses, all those cardiac patients have to be up for all meals, walked 3 times a day. But I've been in, like I said, I've been in healthcare a long time, but I'm non-clinical. But I still look back 20 years later, and I still pull from my experiences on that floor because it taught me so much. I learned how to communicate with the care team. I learned how to communicate with the patient and their family members. I got to work alongside amazing nurses that wanted to share their experiences and share their insight and why do we do the things that we do. And I learned to move patients and transport patients, with chest tubes and IV poles and, all of those things. And so just got that first job and really never looked back.
Yeah, once you get into healthcare, it's like it becomes so much a part of you that it almost part of your identity. Part of your core. Mm-hmm. And even if you're not doing the clinical like you just described, you're still very attached to it and you're still very instrumental in the success of it. Which brings me to you, Jacklyn. So I know that oftentimes you get phone calls from people who are not in healthcare yet. And they say, what do I need to do in order to get to? How do you field those calls and what kind of things do you tell them? And do they only ask you about nursing or are there other areas that you're also asked about?
So yes, it depends on what they're looking for as far as if they're looking for a clinical pathway to go into nursing or something else in healthcare. So very often I start out those conversations with just tell me a little bit about you. What are your goals? What is your life like? Because if they have, 5 children and are a single parent, that journey is going to look very different for them. So trying to get an understanding of where they are. And then kind of like Jamie said, I think starting out as a patient care tech, a PCT, is one of the best ways if you're interested in the clinical side of healthcare, because it gives you the opportunity to experience what it's like to walk into a patient room, communicate with that patient, communicate with the rest of the healthcare team, and then from there, look at what is the best financial aspect to go to school, what is the quickest pathway to go to school, so looking at prereqs, nursing school, all of those things. And I usually talk to them about all the options from being an LPN to an RN, associate degree programs versus bachelor degree programs. And then on the non-clinical side, I get those questions as well. And so we have really strong partnerships with schools that offer all degree programs. Business is a really popular one, accounting, finance. And so helping our employees to identify what those other schools are and connecting them with the right people so they can get the answers to create a pathway for them to help them succeed in healthcare in a non-clinical way.
Right. I love that you included finance in that. Healthcare finance is so unique. It's not the same as being on the stock, working in the stock market or working in a bank. It's completely different. The language is different, even. The things that we measure are different. And so if people have an acumen towards numbers and all of the accounting piece, but they still have a bit of a heart or an experience with healthcare that they would like to combine, that's a perfect opportunity to do that. I love that you brought that in. So for both of you, day to day in your work life, what kind of things just fill your cup and bring you joy? What makes you want to come back day after day after day and do it again?
Yeah. I think that there has been so many cool things that I've had the opportunity to be a part of in the last 2 years. I love working with students, and even if they're like, I'm just not sure, we have such great, I call them early careers, and that they can come into, whether it being, a patient safety attendant, or maybe they're going to work in, in EVS. EVS and dietary, we have to have those folks in the hospital. We have to be able to feed our community and our patients, and we have to have, sanitation, is so, so important in a hospital. If they can get in and kind of get a good feel for that environment and really understand, how a hospital works, what are the departments? Let me lay eyes on these jobs that they may not ever have been, an awareness to them, that have brought to their attention. I think that's what's really exciting for me. What fills my cup is really seeing folks reach their potential. I love talking with students. Students will give you the best. They're really great with their feedback. And, I have the opportunity to talk with them about, what got you into nursing? Why are you interested in Liberty? Where do you want to be? Where have you capstoned? Where have you done clinical? Where have you, why Liberty? And time after time, man, I just love it. And it just gives me kind of goosebumps a little bit. They say, I did my clinical there, and the nurses made me feel welcome. They pulled me in on things that I've never got to see before. They didn't make me feel like a burden. And that's really cool. And so that makes me very proud to be a recruiter at Liberty Hospital. And that is, I really, truly believe, we do amazing things at Liberty.
We do.
Is it perfect? No. Is there work to do? Sure. But when I hear those types of things, I'm like, man, that's awesome. Because they'll also share, I've been XYZ and say, I wasn't felt so welcome, or, what I mean? So, but yeah, I like to, have conversations and just get folks excited. I'm a first generation college student. And so,
I didn't know that.
Yeah. And so healthcare's just been, I love the stair step. I love that you can work, and we're working with a market right now. Folks have to work,
Yes.
And I think that it's exciting to create opportunities for people to build their potential in whatever capacity they may look like in healthcare.
So it sounds like one of the really cool things that you get to do is every day you get to hear why people want to go to healthcare,
right,
and how excited they are about it.
Mm-hmm.
How can that not
right?
fill you
up? It's a cool job.
So then once you get to have those conversations, then I would imagine you sometimes then punt to Jacklyn for the detail and how to get from point A to point B.
Right.
So Jacklyn, what are some of your favorite conversations that you've had, and what are those types of conversations that you have that fill your cup on a daily basis?
So some of my favorite is a little bit of what Jamie said, helping people reach their full potential. So when we have someone who comes in and says, I have no experience, but I think I want to be a nurse. And so we can bring them in to a patient safety attendant position, help them through our PCT class internally, help them find a pathway into nursing. And then when they become a nurse, that is so exciting. When they've been our employee rewarding now for 4 or 5 years, and they want to stay with us because they love Liberty, and we have been able to help and support them and grow them into a great healthcare provider. Those are the things that fill my cup.
Yeah. They do mine too. Just hearing the stories through you, they do mine too. So we have in healthcare a lot of things. Always, it seems as though there's something looming out there. We just came through the pandemic, and we wonder what's next. And one of the things that I learned through you, Jacklyn, primarily, is that because of the pandemic, at first, there was this surge of people wanting to go into healthcare, and then that changed. So can you walk through a little bit about that concern that maybe you see looming out there for healthcare, and how maybe we can, thoughts about how we can best address that?
Yeah, so during COVID, we had this huge surge of people that wanted to come into healthcare, like you said. But now, over the last couple of years, it's kind of backed off a little bit. In one, people not wanting to go into college or go into healthcare. But then two, people who maybe did their last year or two of high school all online, and they're not as successful as quickly in college as what we traditionally experienced. So one of the problems that we are seeing right now is decreased graduate numbers from colleges and universities, which in turn translates to fewer nurses for us on the other end. However, the really positive thing that we are starting to see nationwide and in the Kansas City metro area is applicants for nursing programs are on the rise again. So we are starting to see those numbers come back up. So hopefully within the next couple of years, we will have a greater influx into nursing. I think long-term, we still face a long-term nursing shortage. And so always thinking ahead, 5 to 10 years, what does that look like and what can we do now to prepare for that, knowing that it takes 4 years to become a nurse? Yeah. And so how can we be proactive? And that's where a lot of our programs that, like Jamie mentioned, that we have that help to support people through school and bring them into healthcare, starting with high school students. Bringing them in. How can we excite you about healthcare? How can we expose you to what it's like and show you all the cool things we get to do every day? So then that's what they go into when they major in college.
Yeah, what we do in healthcare, it is really cool.
Yeah.
It is really, really cool.
And, maybe I always, we were able to host Medical Careers Day, and that was really cool. And so to bring in high school students that just have an interest in healthcare and show them, about and kind of just bring in an awareness, whether it be maybe you want to go into radiology. Maybe you want to go into respiratory therapy.
Yeah, and they got to see all those things.
And they got to see all those things. And we had biomed.
And start an IV and give shots.
It was really phenomenal because I think what people don't kind of understand is, how important a biomed tech is. If a caregiver or a clinician's trying to use a piece of equipment to take care of a patient and it doesn't work, that's a problem, or, x-rays or, maybe, even in IT, if those problems, if we don't know how to troubleshoot and things like that, and those programs don't work for, that clinician, that's tough. So I still think in those roles, you're still providing, you have a part in patient care, right? And
Absolutely,
so I think it's trying to connect the dots for those folks, in that realm.
Yeah. So you've talked a lot about high school students coming in. What about people who have maybe had a career and now they're looking at maybe a different career? So healthcare as a second career. Have you had much exposure to that through people being interested, or have you had many conversations around that?
So the answer is yes. Shortly, the answer is yes. Through several of our schools in the area, there are accelerated nursing programs, and those accelerated programs are for anyone who has a bachelor's degree in something else. You can go back, get your bachelor's degree in nursing in a year. So 12 months of nursing school, really tough, really a challenge. However, that is a great option for somebody that has a degree in something and knows they want to get into healthcare. A lot of times when I talk to these types of people, they are already working as a tech because they know that they want to get into it. They've already experienced the college life. They're adults. They have a pathway at this point. And so they are a tech. They are driven. They know exactly what they want, and they're ready to go to school and come to work.
That's perfect. That's perfect. Do you guys have this magic ball that you can look into and say, this person would be great for healthcare? Or when they tell you, I really want to go into healthcare, but the sight of blood just makes me just pass out cold. I mean, do you have like signs for this would be a good person to go into healthcare, or maybe there's a different part of healthcare that would be more appropriate for them? What are some of those signs? And how do you direct people?
Yeah, I mean, I think it's just really sitting down and having a conversation. Just Jacklyn had mentioned before, what is your schedule like? What's your commitment like? Like, what can you commit to? There's a lot of things in healthcare that I think that we can do a really good job on training folks on. But at the end of the day, you have to care about people. We can't teach you empathy. We can't teach you
Sure.
to care about others. But my philosophy is if you have a heart for people, there's a place for you in healthcare. And we just have to figure that out. But if blood's not your thing, that's okay. That's okay. We can still find a place for you. I think that the landscape of healthcare, and probably what has kept me in it so long now that I think about it, is that it is, the landscape is always changing. And so I would say you have to be kind of like ready to roll, just and with the changes that come with healthcare. But I also think that's an exciting piece of it as well.
I would agree completely. So, Jack, I don't want to throw a curve at you. Surprise! Jamie just talked about some amazing stories that she's been able to experience. Within nursing, I know that you working with the professional development and the continued growth of those in healthcare and those in nursing, I know that you work a lot with that, but could you talk a little bit about the art of nursing and the compassion of nursing and the things that are required there, and then even expand that further out to those who work in ultrasonography or those who work in the lab or in other areas of healthcare that aren't specific to nursing?
Yes. So a lot in nursing, we talk about the art and the science of nursing. And so the art being the caring, the compassion, the empathy, all the things that Jamie mentioned that are inherent to a person. We can't teach you those things. The science, on the other hand, I can teach you the anatomy, the physiology, how to do a skill. And so looking at healthcare providers, whether it be a clinical provider at the bedside or a non-clinical provider, say in finance, you have to have that heart for people no matter what you're doing, because we in healthcare, we see people on their very best days and their very, very worst days. And even if you're in finance, you may still talk to them as they are experiencing the repercussions of their very, very worst days. And so you have to be able to have that heart and compassion and empathy for helping others, whether it be over the phone, in person, sitting at their bedside, in any type of setting within healthcare.
Yeah, another setting in healthcare is the education setting. So I'm going to keep you talking just a little bit. You were, prior to me being able to meet you, you were in education. So can you talk a little bit about your experience in education and what type of students you experienced and what you really look for in a student? What qualities would a student bring that would make them absolutely perfect to go into an acute care setting or any other field of healthcare?
So my experience on the education side, I've been in education for 12 plus years, both teaching undergraduate students, so students at the bachelor's degree level and master's level students, all on the nursing side, of course. And when you're looking at applicants to a nursing program, while of course you want students who are academically successful, because nursing school is a challenge, it isn't easy, you also really look for students who can communicate well, students who can work well in a team, people who are willing to go the extra mile to help someone without even being asked. And so those are some of the qualities that you can just pick up when you talk to someone and know, like, okay, this person's going to be a good fit for healthcare once we give you all the science and the background that you need to succeed in that area. And I think all of that translates exactly into what I do now because of all the work that we see with high school students, getting to interact through Medical Careers Day, through some of our high school internships, through our CNA program, and then, guiding those that truly have that heart and desire into nursing programs or other clinically related programs to become healthcare providers down the road.
Mm-hmm. So if you go into nursing, let's say, are you locked in to that for the rest of your professional life? If not, what can be done about that?
So that's the great thing in nursing. Yeah. There is something for everyone. You kind of alluded to it in the beginning, you could go into 100 different fields. I think I'm a good example where I started as a CNA. I went into became a bedside nurse. However, even when I was in college, I always knew I wanted to go into education. And I haven't been a bedside nurse in over 12 years, but I am still very much intimately involved with nursing, with patient outcomes, and making a difference in the lives that will then touch our patients. So whether it be you want to be a leader, an educator, a nursing informaticist, a consultant. There's 100 different ways you can go, still be in nursing, still be in healthcare, and still impact the care at the bedside. And to me, that's what's really important and fulfilling.
Yeah. Such great things that you guys get to do every single day. So I want to ask each of you one final question. What is your absolute favorite story that you can share with us about your experience in healthcare? Jamie.
So, one of my very favorite stories probably just happened like 3 weeks ago. Since I've been at Liberty and in my role as a recruiter. And like I said earlier, you as a recruiter, you do things. We're kind of in uncharted territory right now. We're doing things that we've never done before. We're going to events we've never done before, and we're just saying, hey, you know what? Let's just see. Started walk-in Wednesdays. We had a candidate come in, and she interviewed. We brought her on as a patient safety attendant. She had no healthcare experience. Brought her in. She was able to observe on the acute care side, on our inpatient units. Really quickly said, hey, I want to do more. She went through our internal CNA program, and I was able to go with her. And she wanted to speak at her high school about Liberty Hospital and being a PCT there. And I had the privilege of going with her, and she did such an amazing job. And I mean, now she wants to go to nursing school. And
She's starting in the fall.
She's starting in the fall, and so
That's
is
amazing.
just huge. And I called Jacklyn and was like, I was kind of teary-eyed all the way home, because you do these things and we're in it every single day. And then you're like, wow, that is huge.
Yeah.
That's really cool to be able to experience that as a recruiter.
Yeah. Yeah. Jacklyn.
So I have a lot, unfortunately, I don't know. But I think the biggest theme for me is hearing from students and people that I taught or helped them find a way, hearing the greatness that they're doing as a nurse now. So I had been teaching, it was probably my very first year that I was in a faculty role. And it was at a small school. All of our students stayed in touch with us after they graduated. And it was less than 6 months after graduation, I get this phone call from one of my students, and she was so excited, just like over the moon excited. She goes, "You're never going to believe what happened." And I'm like, What? I won a Daisy Award.
Oh.
And here's this 6-month out nurse who won a Daisy Award, which is, as you know, for extraordinary nursing care. And she was so proud of herself, so just enthused with nursing in general and what she was able to do. And that just really stuck with me, because she was able to do what she was doing because of the education that we were able to provide her from the school side. And that happens not constantly, but over and over again, to where it's just always such a positive when you hear all the great things that your students get to do.
So everything that you guys have shared today they're amazing things that you get to do. And not only do you have you impacted the lives of patients that you've been able to serve and assist and help, but now the roles that you're in, you're able to impact the lives of the health care providers, and you will forever be in the memory of their successful careers. And that's huge. You have impacted an entire life and possible generations to come. So, my gosh, thank you so much for joining me today and for the work that you do. It's remarkable work that you do, and you're both to be commended for that.
Thank you.
Well, thank you guys so much for joining us. I can't even begin to express how appreciative I am of the work that you do. And thank you for watching us today. And I'd like to invite you, our viewers and listeners, to send us your ideas for topics and connect with us. You can find us on TikTok at The Heart of Health and Science, or connect with me personally on Facebook, Instagram, or LinkedIn. Thank you so much.